The use of bioelectric signals, life electric signals, a frequency. When you have your car and you want to open it, there's a frequency that comes out that opens your car. Bioelectric signals, or otherwise known as frequency-specific microcurrent, a current that goes in at a specific frequency that is going to have, the goal is positive outcomes for that tissue, organ, cell system. The use of microcurrent and specific microcurrent at certain qualities of that current has been used throughout the body, and eyes included, to improve, as an eye doctor, macular degeneration and glaucoma and inflammatory eye diseases. It's been used throughout the body. There's a group that work with called, you can look up EyeCell, EYE-CELL.com, and see what's going on with the use of specific frequencies that are going to upregulate or encourage things to come about, upregulate certain proteins. The same current can downregulate certain proteins. And there's a tapestry of things and considerations that have to happen in order for this to be properly managed and exposed to the body. I'm Dr. Peter Wilcox, and there's Dr. Brendan White in Sandy, Utah, who are going to be first replicating the work of Dr. Lori Chaikin. And the work she did was to prove that FSM, or frequency-specific microcurrent, can assist those with dry and wet macular degeneration and a number of other eye diseases. We're going to add to that, after a certain phasing in with patients, we're going to add to that the use of some frequencies that we're going to upregulate a protein called klotho, Klotho, based upon a Greek goddess about longevity. You can go look it up and Google it. It's kind of interesting. But this protein in the body is largely found in the kidneys and the brains, though not really known where it's produced. But the more klotho you have, the longer you live a healthier life. Conversely, the less you have, the shorter, more diseased life you have. So klotho can be studied. You draw some blood and you study it. It's a little bit more difficult draw to have, but and not in the draw, but in the studying of it. But you can look at this and see if exposing the eye to certain frequencies is going to upregulate or increase the amount of klotho in the body. It's been done, it's been proven, and we're doing it with the eyes with macular degeneration and moving forward from there. So in this doctor-initiated study, replicating an optometrist's work, and she works with ophthalmologists as well, working with dry macular degeneration, and then we're going to be introducing the frequencies for klotho and then marrying them together. And we appreciate the fact that we have a number of trusting patients with this no-risk, high-reward use of these frequencies in a terrible blinding eye disease called macular degeneration, which currently has no known cure. We're happy to go through this, and we have different tools we're using. One of what Dr. Chaikin used was some felt pads. These are brilliant. They look like arts and craftsy, but they're brilliant. You wet this and you have these, it's connected to a device that emits these microcurrents to the eye, a thousandth of a amp. And then we have these goggles that have been used as well, and there are these comb electrodes on the back, and there's some wetness that is put on the goggles, and those are worn on the patient for the unit of exposure of these microcurrents to the eyes. And the engineers are going to come up with something sexy and pretty by the time this is all over, so that what will happen is you, in the future, when we prove yet again and increase the dictionary of frequencies that we can use and the staging of them, just like when you go through a meal, you have your appetizer, your meal, your dessert. Well, that's how healing needs to happen in the body. And the microcurrent will be used in office, where the patient will come in, and/or there'll be some take-home devices that will be calibrated in such a way that the patient can use them on a daily or near-daily basis. So we're happy to be part of the growing world of researchers and doctors and scientists and engineers and the amazing amount of people who have to go in to make things like this happen, and the funding that has to happen to do these things, and the patients who are given their time in these studies that are blinded or double-blinded studies where they lovingly go through the process in order to help all mankind improve these diseases. I'm Dr. Peter Wilcox. Dr. Brendan White is involved in this study as well. A legion of other people behind the scenes. Frequency-specific microcurrent, bioelectric signaling, and under the iCell assistance and funding. And I thank you and look forward to answering any questions that might.